So going back to the other aspect of RNDCP, so as I told, now presently we are in a stage of new national strategic plan for TB elimination. So in that 2017 to 25, this is the period we are at presently under the TB activities. So this NSP, that is National Strategic Plan, proposes bold strategies with commensurate resources to rapidly decline TB in the country by 2030 in line with global and TB targets and sustainable development goals to attain the vision of a TB free India. So according to this plan, we are planning to eliminate or decline maximum number of cases with TB by 2030, which is the target of this global and TB strategy, and even SDG and MDG also is having the similar strategies of completely eliminating the TB and making a country free of TB. So we are moving with the targets and activities in a more advanced way, in a better way to control the TB and eliminate the TB from India. Coming to the vision and goal of this NSP, TB free India with zero death, disease and poverty due to tuberculosis. So main vision is because of tuberculosis, death, diseases and poverty are the common issues that is faced by the TB affected patient. So initially, because of the patient health condition, the poverty is coming up, and later on the morbidity and mortality is increasing among the family members and the patient. So we are trying to remove all these issues because of TB. Main goal is to achieve a rapid decline in the burden of TB, morbidity and mortality while working towards elimination of TB in India by 2025. So this NSP is having 4 pillars, that is detect, treat, prevent and build. The requirement for moving towards TB elimination have been integrated into 4 strategic pillars, that is DTPB, that is detect, treat, prevent and build. So let's see what is coming under this. First one is detect, the scale-up free high sensitivity diagnostic test and algorithms. So we have already learned about advanced diagnostic technologies. So that is being implemented, and now presently all the diagnostic tests are being done through these advanced technologies, so the quality of result is being ensured. Scale up effective private provider engagement approaches. Always training is given for the provider, DOTS provider, and provider is being motivated well to provide the medications on regular basis. Universal testing for drug resistant TB, systematic screening of high risk population. So all these are being done as the part of detection. Thereby more and more number of cases are being identified. Thereby we could able to provide the treatment and prevent further burden in our country. In the treatment aspect, prevent the loss of TB cases in cascade of care with support system, free TB drugs to all TB cases, universal daily regimen for TB cases and rapid scale up of short course regimen for drug resistant TB and DST guided. So presently, as we have discussed in last class few classes, we were saying only about DOTS. So about fixed daily combination. So that is being implemented in an advanced stages to make the TB services more successful, to prevent drug resistant TB in providing the medications in a very short course, so that the patient will cure earlier, patient will not have issues of drug resistant TB. So in that way treatment modalities are improved. In prevention, scale up airborne infection control measures at healthcare facilities, treatment for latent TB infection in contacts or bacteriologically confirmed cases, address social determinants of TB through intersectoral approach. So all these aspects are being done. More and more rallies and awareness programs are being conducted in each year. More and more advanced way the observation of the days are being done, so that public are more aware about this, so that they will take the control measures. Regarding the control measures and all the aspect of prevention, IEC materials are being provided through all the mass medias, thereby public become aware and prevention aspects are being taken by the general public, so that we can reduce the number of cases. Build and strengthen enabling policies, empowered situations, and human resources with enhanced capacities. So there are various policies and legal formalities in implementation of this program. All these things are being strengthened. Translate high-level political commitment to action through supportive policy and institutional structures. Lot of non-governmental organizations are supporting in provision of the treatment diagnostic services, and high level of political commitment is there for the implementation of program. All these things are being strengthened well, so that the implementation of services will not have any delay. Okay, so this is all about NSP, that is National Strategic Plan. Now let us see about the organization structure of RNDCP. This is the organization structure at the state level. Head is Health Minister, followed by Health Secretary. There is MD in the NRHM level and Director Health Services, and under that there is a additional Deputy Joint Director at State TB Officer, and under that come the State Training and Demonstration TB Center Director, IRL, microbiologist, epidemiologist, statistician, etc. is working under this TB Center for the for proper implementation of the TB program. TB cell, state TB cell, deputy state TB officer, medical officer, accountants, IEC officer, TB, HIV coordinators, all are working together under the state TB district and state TB cell for better establishment of the RNDCP services. So this is the organization pattern at state level. At district level, we have district administration under district collector. Under Chief Medical Officer and supporting staff, we are implementing the services through DHS, that is District Health Services. Under that, we have District TB Center. Under District TB Center, we are having TB units. About that, we have already seen the schematic representations. Right hand side, you can see who all the members who is responsible and working under this TB unit. Under the TB unit, there is a medical officer, senior treatment supervisor, senior TB laboratory supervisors, microscopic center and dot center. So one nodal point for TB control, that is 1 per 5 lakh population, there is one nodal point.